The coroner has determined a 1-month-old girl died of sudden, unexplained infant death.
Law enforcement says co-sleeping was a factor in the death of a 4-month-old baby girl this morning in East Bakersfield.
It has been more than a month since a 4-month-old baby died, and today the coroner's office says an autopsy reveals she died from sudden, unexplained infant death.
Safe sleeping is an issue we follow closely here at 17 News. Why? Because unsafe sleeping is the most common cause of child death here in Kern County. Experts say babies should sleep in a crib or a pack and play with a firm mattress and a fitted sheet. There should be nothing else in the crib but the baby. No pillows, blankets, stuffed animals, or bumpers. Your baby should be placed on his or her back, and nothing should cover the baby's head. For more information, you can visit our website, kerngoldenempire.com, and click on the Safe Sleeping tab.
All the families we've spoken with say the same thing. They never thought this would happen to them, but it can. Co-sleeping was the #1 cause of death for local children in recent years. Because of that, we continue to emphasize the importance of safe sleeping for babies. No one can stress that more than a mother who tragically lost their child. Jim Murray Robinson was born August 24, 2016.
She was perfectly fine. There was nothing wrong with her. No health problems at all. She was healthy.
And happy. Najee Avila often capturing her smiling and laughing.
Just a little bitty baby.
But then the unthinkable happened. Avila woke up to her baby girl not breathing.
I only had 4 months with her, but those 4 months was the best months. She was learning everything.
Jim Murray was in bed with Avila and 3 other children.
Nobody ever puts a baby in bed with them thinking something bad's going to happen. They really do it with the best intention, with love in their heart. But it can happen to them.
Avila has struggled to understand why this happened, and she's not alone.
It just happened. I don't know. I never thought I was going to go through this.
Araceli Guzman took 2-month-old Nathan out of his bassinet in the middle of the night to breastfeed him. Instead of putting him back, she kept him in bed with her and her husband.
So when I checked him, he was, and half of his face was all purple, and the other side he looked kind of pale. And when I grabbed him, when I carried him, he was hard, cold, and for me, he was already dead.
New at 5:30, it is a topic we continue to highlight here on 17 News, the importance of safe sleeping for babies.
For the last 2 years, our Kristen Price has brought awareness to the #1 cause of death for babies in our county. And she joins us tonight with more on a milestone for a local hospital. Kristen?
Tammy, as a result of our reports on this life or death issue, Kern Medical began an educational program on the importance of safe sleeping. It's been 1 year since the program started. During that time, they've provided more than 700 portable cribs to families who could not otherwise afford it.
Hi, baby.
It's as easy as ABC.
The baby needs to sleep alone on the back in a crib.
Kern Medical has reached nearly 3,000 families in the last year through inpatient education and monthly classes open to the public.
It makes me think like, wow, I was doing a lot of that stuff. Like, I need to stop.
Through safe sleep education, families learn ways to prevent these tragic deaths.
You don't know what you're doing when you sleep. So to roll over and hurt your child unknowingly, it's scary.
According to the latest county child death report, 12 babies died in 2015 due to unsafe sleeping. Already this year, co-sleeping was a factor in at least 1 death.
If we can just save 1 or 2 babies in Kern County, that's already would make a difference.
For information on safe sleeping and how you can donate to the cause, visit our website, kerngoldenempire.com, and click on the Safe Sleep icon. The next class at Kern Medical will be held March 22nd. Presentations are offered in both English and Spanish. To sign up, call Kern Medical's Safe Sleeping Hotline at 326-2606.
Today, Kern County supervisors are expected to approve funding to buy safe sleeping accessories to protect local babies. According to the latest county child death report, 12 babies died in 2015 due to unsafe sleeping.
Local advocates say the effort to reduce the number of unsafe sleeping deaths is paying off. 17's Kristen Price is here with the details. Kristen?
Tammy, the Child Death Review team presented an overview of its annual report today. It shows a significant reduction in the number of local unsafe sleeping deaths, but there's still more work to be done.
Hi, baby.
The importance of safe sleep is something we continue to emphasize here at 17 News. It's the #1 killer of local kids in recent years. But a new report shows that's changing.
We've seen a reduction due to the community outreach and due to some of the attention from both the media, faith-based community, and our hospitals.
According to the Child Death Review Team, so far this year, unsafe sleeping was a factor in 2 infant deaths. Last year, there were 7, down from 12 unsafe sleeping deaths in 2015 and 16 in 2014. Although numbers are down, prevention is key.
We can't slow down. For instance, unsafe sleep, it's October, it's going to start to get cold. Let's hit the message hard.
Experts say unsafe sleeping deaths often increase as temperatures decrease because parents are more likely to co-sleep.
We need to be proactive and not be afraid to speak about some of these issues.
The report also focuses on suicide, child abuse, and drowning prevention. 6 local children committed suicide last year, the youngest just 11 years old. There were equally as many drownings, and 3 children were victims of homicide.
We have to be advocates for children, because at the end of the day, they have us to protect and look out for them.
Children should sleep alone on their backs in cribs. For more information, visit our website, kerngoldenempire.com, and click on the safe sleeping icon. Now to an issue we continue to emphasize here on 17 News, the importance of safe sleeping for babies. And today, local agencies received another tool to provide community education through a children's book.
Good night, Mom, Dad, Teddy Bear. You'll sleep soundly over there.
Sleep Babies Safe and Snug is a short story reiterating that babies should sleep alone on their backs in cribs. The Safe Sleeping Coalition of Kern handed out more than 1,600 copies to 41 programs serving families and infants. Through the Kern Literacy Council, the coalition received a $2,400 grant from the Children's Advocates Resource Endowment, also known as CARE.
And the books are really cool books. They're easy to read, Spanish and English, and we have several. We're giving them to hospitals and different things and distributing to places where mothers coming out of the hospital will have those.
Unsafe sleeping is the #1 killer of local babies. More than 100 babies have died since 2008. Unsafe sleeping was a factor in 9 infant deaths so far this year, and these deaths are preventable. Again, babies should sleep alone on their backs in cribs, and there shouldn't be anything in the crib but the baby. This message is especially important during the winter months when experts say 90% of these deaths happen. For more information, go to our website, kerngoldenempire.com, and click on the safe sleeping icon.
Now, you're a very humble person, and I will say this because you wouldn't, but that book is the product in part of your reporting on sudden infant death syndrome and child deaths here in Kern County.
It's amazing to see so many people coming together to work on this issue.
Yeah, way to go.